Is there a way of thyroid reversal? Because I've been hearing this word of thyroid reversal a lot these days. What is thyroid? Where is it located? Why are so many people having it?
The thyroid actually controls your entire functions of your body. It's called the master hormone. On Dr. Google, there are many people
Dr.
promoting.
Google?
Dr. Google, there are many
Yes.
people promoting ways of reversing thyroid. It's not true. If you're born with a deficiency in thyroid, which is a genetic deficiency that you've inherited from either your mother or your father, and you identify it, the only way to make up that deficiency in the thyroid hormones and get rid of your symptoms, that is, eliminate your symptoms, is with making it up with the missing hormones. 18% of the hormones, thyroid hormones, can be found in the blood at any one time. So if I'm going to shoot you,
So only 18% is present in the blood and the rest
Yes.
of it is present where? I've seen so many patients who are coming to me like, I've been this way for my entire life.
we address the quality of life. Balance your thyroid and you get beautiful.
I am Dr. Rash, your host, bringing you unfiltered conversations with top doctors from different fields. From cutting edge treatments to medical myths, we are breaking down complex health topics in a way that's simple and honest. No jargon, no fluff, just straight up insights from the experts you trust. Stay tuned as we uncover the truths behind medicine, one episode at a time. Let's get started. We have Dr. T today. Hello, Dr. T.
Good morning, Dr. Rash.
Yeah, what's up?
What's up? Is that an app or you want to really know what's happening?
You don't understand what's up, so that's the generation difference. No, I'm just asking you, how are you?
I'm actually always good. I never ever have a down day.
With your age and all, I might have to reconsider that.
I don't think so.
I don't think so too,
No.
I'm just kidding.
Yeah.
No, you're always very energetic.
Yes.
So, shall we start the discussion of a thyroid and autoimmune today?
I'd love to talk about it. That I live my life for it and I live my life in and around it.
All right. So, let me tell the audience a little bit about what Dr. T does. Dr. T is a thyroid and autoimmune specialist, and he's been all over the world treating over 2 billion patients last year successfully. And he has discovered a machine called Thyroflex. So, we are going to dig deep into thyroid and autoimmune, what he does, Hashimoto's, etc., all the big words. All right, shall we start?
They might be big words for you, but for me, they're part of my life.
I'm also a doctor, but a junior doctor. All right.
I think that you're well credentialed as a doctor, Dr. Rash.
Thank you. Thank you. So, Dr. T, let's start from the basic. So, our audience are all from the doctors to the layman. So, I want you to be as basic as possible, which you are most of the time explaining about everything. So, let me start with a very basic question like, what is thyroid? Where is it located? Why are so many people having it?
The thyroid is this little thing just at the base of your neck. You can just feel it. And there's a thing called a thyroid cartilage just above it. But the thyroid actually controls your entire functions of your body. It's called the master hormone. So if it's out of balance, which it is in 80% of the population, it's hereditary, out of balance, then it affects the quality of your life.
So 80% of the population, in the sense, like, that's a lot. So why do you think, like, is it just hereditary, or it's because there is some deficiency? What are we doing wrong?
You're not doing anything wrong. 98% of all thyroid is hereditary unless you, I don't want to get too technical, but unless you fall into a thing called euthyroid 6 syndrome with a major illness.
Okay, that's a big word. Explain it.
That is where you have a major illness and it knocks your thyroid out, it knocks your thyroid function out, which you can recover from.
So there is treatment for it.
Always treatment, the right sort of treatment, to make your thyroid function normally?
So there's one big question. Like there is this notion, I'm not going to call it a notion as well, but there is this thing that in the society, most people don't want to start their hormone treatment yet, even if they have the thyroid disease diagnosed, because they assume, which is actually true, I believe, that when you start yourself on hormonal treatment, you have to be, especially thyroid hormonal treatment, you have to be on it for your lifelong, which is true. But is there a way of thyroid reversal? Because I've been hearing this word of thyroid reversal a lot these days. Reversal in the sense I am meaning without any supplementation, without any hormonal medication. Is there a way of escaping it without using any medication for the rest of your life?
On Dr. Google, there are many people
Dr.
promoting...
Google?
Dr. Google, there are
Yes.
many people promoting ways of reversing thyroid. It's not true. If you're born with a deficiency in thyroid, which is a genetic deficiency that you've inherited from either your mother or your father, and you identify it, the only way to make up that deficiency in the thyroid hormones and get rid of your symptoms, that is, eliminate your symptoms, is with making it up with the missing hormones.
So you are saying that if a person has ever been diagnosed with either Hashimoto's, autoimmune, or just the hypothyroid, any thyroid disease, they have to be on the supplementation for their life. There is no way other than that.
What you're actually talking about are the autoimmune diseases, but thyroid in general, you have to be on medication. With Hashimoto's, Graves', hashimotoxicosis, reverse T3, they are temporary interventions. Once we get you on the straight and narrow, you have to be on maintenance for the rest of your life. That is 3 basic hormones for the rest of your life.
What are the 3 basic hormones?
The 3 basics are natural bioidentical thyroid, containing T1, T2, T3, T4, and T7. Iodide to make the conversion into a usable form that your body can use, and a hormone called D3 with K2 that opens up the receptor pathways.
I have to stop you there. Why did you call D3K2 a hormone? And me as a doctor, I know that D3 is a hormone and about the vitamin side, but we want to hear it from you. Vitamin D. And
not
you're
a
calling it
vitamin.
a hormone.
It's not a vitamin.
So you're saying vitamin D is not a vitamin, it's a hormone.
When they first identified D many, many years ago, they mistakenly thought that it was a hormone. It's actually
So it's a misnomer.
misnomer.
So all these people who think that they should be on the hormonal supplementation for the rest of their life are already on hormonal supplementation by taking vitamin D.
Yes,
Already.
exactly.
They just don't know that that's a hormone.
Of course, it's got the word vitamin in front of the D3, but it's actually a hormone.
But there are also a lot of other misnomers in medicine. But let's stick to the topic.
Yes,
All right.
absolutely true.
Yeah. So autoimmune. You're saying that there is treatment and management for the thyroid, but autoimmune is curable. That is Hashimoto's.
I discovered the protocols for reversing Hashimoto's. It's the only one in the world.
Yes.
It is reversible and curable if you have the right sort of treatment.
So Hashimoto's is autoimmune condition. That is, the antibodies are high. And you can bring those antibodies down to normal. So Hashimoto's is cured. But whatever the damage that has already occurred by thyroid, you have to give the supplementation for the rest of your life for the hormone that your body cannot produce anymore. Right?
That you're on the right track, Dr. Rash.
But
The intense intervention to cure Hashimoto's is only short,
okay.
about 1.5 to 2 years. After that, it is
1.5 to 2
maintenance.
years?
Yes, to reverse Hashimoto's.
That is short. I mean,
It's-
1.5 to 2 years to get their antibodies back to normal
Yes.
is a pretty long road,
Yes.
don't you think?
Well, as you know, the antibodies are actually attacking and destroying your own thyroid in your
Yeah.
body, as well as any incoming medications. We make the medications work, and we're able to get it under control. Once it's under control, it is maintenance. And it changes your life forever, the quality of your life forever, and stops the cascade of other autoimmune responses.
Great. So I would like to ask you one question based on a case, the cases that I've been seeing. So I've seen quite a lot of patients who have all this sort of thyroid symptoms, that is easy weight gain, heavy menstruation, history of fibroids, irregular menstruation, hair fall, puffy hands, cold intolerance, especially they feel cold all the time, the hands are cold, etc. etc. Patient is a classical case of hypothyroidism. But when we run their thyroid profile, their TSH free T3 and free T4, the blood tests are absolutely normal. And they go to their doctors, and the doctors just see their thyroid profile and they just say that it's in your head, work out, eat well, and you will be fine. But they cannot, because the average people who are working out and losing weight and being happy with their bodies and with their menstrual cycles and mood, these people cannot. So some doctors and practitioners, including me, we have just risked, and with the clinical symptoms only, we have considered this patient as subclinical hypothyroid, and we have treated them with the minimal dosage of thyroid supplementation, and they got amazingly better. So in
Yes.
such scenario, the patient is having all sort of symptoms, and I can call that patient a clear-cut case of hypothyroid. But the blood tests are not showing anything in the, the numbers are they wrong? Are these tests even valid? Tell us about it.
Very interesting summary, Dr. Rash.
Thank you.
And in fact, you are on the right page. None of the blood tests are valid. That is TSH, T3, T4, free T3, free T4, according to Sir Dr. Richard Bayliss, head of the Endocrinology Society in Europe. He stated a few years ago that only the speed of the reflexes and the symptoms. Did you know that most doctors don't even ask you your symptoms or even have time to ask you your symptoms?
Yeah,
And you-
check.
yeah.
Just get the patient
You
in,
come in
write
sick,
down, and just go.
And you
boom,
got your
next
bloods are
patient.
okay. Yes, exactly.
Yeah.
And that is the problem. If you allow the patients to tell you the symptoms, and they are suffering from exactly what you said, menstrual cycle, irregular periods, being cold all the time, the brain is going, constipation, it goes on, and the list goes on and
Yeah.
on and on. And the doctor allows them to suffer for those things for the rest of their lives. This is not temporary. Then,
Because they don't know that blood tests are not valid.
yes, then they're relying on blood tests and not what is valid. What is valid is the speed of the reflexes and the symptoms. It's very simple.
Wait, so you're saying speed of the reflexes and the symptoms are valid. Symptoms, we are getting it okay. Speed of the reflexes, in the sense you're talking about the knee reflex that you do with the hammer on your knee and you get a reflex. Is that what you're talking about?
Absolutely correct.
So,
But you can do the Achilles reflex or the knee reflex, but you have to be a very good skilled doctor to see the difference in minutes of a second.
exactly, because I don't know, but I don't think doctors in this generation, except for a pediatric case, they are doing any knee
Except
reflex.
for doctors of my generation.
Yeah, because I haven't seen any doctor performing a knee reflex on me, and I go to hospital all the time for even a little thing when I was a kid. My mom is a scared one, so she used to always rush me, even for a fever. So yeah, so knee reflex, it takes for an exceptional practitioner to say that the reflex is slow, the reflex is fast. Like, how accurate is that? How can we see that?
Back in the 1940s and 50s, when I was a young boy, my doctor used to tap my knee all the time and judge the speed of my reflexes.
Really?
It was very common practice. In the mid-1970s, they decided to use blood. but it is an invalid form of determining thyroid function. My doctor used to ask me when I was a young boy, do you have cold hands, cold feet, constipation? I didn't know why he was asking them and why he was tapping my knee. He was determining whether I needed thyroid or not. Today, that is gone.
Yeah, but how do we do this reflex test just by looking at your knee reflex? I don't think it's practically possible. How do we do that?
Well, I actually invented, created, and developed and patented worldwide a device that measures the speed of your reflexes plus your resting metabolic rate, because don't forget that thyroid controls your weight.
Yeah,
And-
it does.
And I combine that with the symptoms that the patients tell me, and I have a complete picture. That's 98.5% accurate.
So you're saying the machine that you have invented, that is Thyroflex machine, can measure the speed of the reflexes, that is in milliseconds.
Yes. Very, very accurately.
So an
And
average
repeat
is
the
50
test.
to 100 milliseconds is the normal optimal. And if the patient is having any measure, does it give a number?
It gives you a number of the neurotransmitter, how fast your brain is working. It gives you the speed of your reflexes. This is all happening in less than half a second.
Oh, wow.
So it's very fast for the human eye to track. Even when you're testing the patient, you see their reflexes react. And the reflexes tell the true picture. Listen to what Dr. Richard Baylor said. Reflexes, symptoms, not blood.
Oh.
And that's why we've had so much success worldwide with 2 million plus patients.
So what is the mechanism behind this test? Like, how does it check the reflexes? So you bind it to the knee and check for the reflexes. Are there any sensors in it? Like, how does it
Yes.
work?
There is an official name. It's called the Waltman's effect. I don't know if that's too technical for this show.
Yeah.
But the Waltman's effect has been known for a couple of 100 years. And we are taught, and you were taught in medical school as well as me, that the reflexes speed up and slow down with thyroid function. Your heart is the biggest reflex muscle in your body. Your heart rate, if it's slow, is correlated with thyroid function. Fast, correlated with thyroid function. Hypothyroid. Skipping of the heartbeat, the missing of heartbeats, the rapid heartbeats are all controlled by this little thing here, your thyroid. Every reflex point in your body is controlled by your thyroid. We test what is known as the brachioradialis on the arm in a very quick test. That's only
So
a couple
instead
of
of
minutes.
instead of the knee reflex, you are testing the brachioradialis muscle on your arm.
Yes, because it's easy.
Just because it's easy.
Yes, you can sit down at a table and we hit your arm, and in a couple of minutes it's over.
All right. So just tell me, what is it that test is doing? What is the mechanism that the test is doing that the blood tests are not doing?
Well, first of all, we're not going to test you if you don't have the symptoms.
Yeah.
The symptoms out of my endocrinologist sample, if you score a certain score on the symptom survey, you're telling me that you have the symptoms. I'm not going to ignore you.
Yeah.
I'm not going to do a blood test. I'm going to do a reflex test and get it right the first time.
All right. So the question is, you're saying blood tests are not valid because the thyroid hormone is not present in the blood test as much as it is present in the muscle that is giving you the reflex?
I'm testing the end artifact of thyroid function. Only 18% of the hormones, thyroid hormones, can be found in the blood at any one time. So if I'm going to shoot you...
So only 18% is present in the blood and the rest
Yes.
of it is present where?
in the muscles, skin, and brain. And that's exactly what we test.
So that is the reflex. When you are
Yes.
hitting the muscle
Yes.
and the skin, then you give a response for the sensory stimulus that you are testing the brain also.
Yes.
So all of these three things are covered. That is, your muscle, skin, and brain are covered if you're
Yes.
just testing one reflex.
Yes.
That makes
Correct.
much sense, actually.
Yeah. Because it's the end artifact of where the thyroid ends up. Your blood is only shunting around a little bit of thyroid hormone at a time. So you got a bigger chance of missing the target. As I said, 18% are of the hormones are in the blood. The rest are in the end artifact, muscle, skin, and brain.
Great. But if the patient is autoimmune, we are definitely doing a blood test, right? For their antibodies.
We actually pick up if the way the patient answers the question.
Yeah. But we just want to have the
do a
confirmation.
blood test for Hashimoto's, Graves, or reverse T3.
Okay, so for Hashimoto's, Graves, and reverse T3, we are doing the blood work and seeing the autoimmune test and seeing the autoimmune antibodies. But
Correct.
for the initial intervention and for the follow-ups and to even know that you have a thyroid problem, you don't need a blood work.
You do not need blood
And
work.
it's non-invasive.
And it's 100% non-invasive.
Does
which
it
many
hurt?
of your patients are going to like.
Does it
They're
hurt?
not going to get jabbed by a needle.
Are you going to hit my brachioradialis with the hammer? Like, does it hurt?
A little bit. It doesn't hurt. It's uncomfortable.
Okay.
Yeah.
All right.
Because I am inducing a reflex. If I hit your knee, it's uncomfortable. Right?
Yeah.
If I hit your arm, it's uncomfortable. But it's non-invasive. That's the main thing.
Yeah, it's non-invasive. How long will it take for you to do this test, and how long will we get the reports?
From
Tell us
start
about
to
it.
finish, the test is 4 minutes.
4 minutes.
Yes, and the report is instant. So we can identify you with 98.5% accuracy. We can treat you right there and then. No more guessing.
Great. So we'll all get checked then.
You should get checked because if you have the symptoms, we want you to be symptomatic free. And that's what our millions and millions of patients around the world who have been tested and have been treated have big smiles on their faces because we are listening to them. Most doctors do not listen to their patients, do not ask them the symptoms, do a blood test that's invalid. We do the exact opposite. We listen to the patient, we test the right thing, and we get it right every single time.
That's why you are this amazing doctor. So where can we find you if anybody wants to, get your consultation or get themselves tested? Like, you have too many companies around the world.
We have two websites. One is called uniworld.com, and which is our Indian site, and then we have a second site for the rest of our patients around the world, which is NITEC Medical, NITEK medical.com.
I'm going to keep this in the description, don't worry.
Yes, okay.
I know you don't understand this social media.
No, I'm just learning.
Yeah.
Yeah.
And thank you for coming here and thank you for doing this. I know you don't understand with whom you're talking, what is all the setup, all of this, but it's going to be worth it. People need it. The new technology, and many are suffering just like that and living their lives for their entire lives. I've seen so many patients who are coming to me like, I've been this way for my entire life. I've been like this from my childhood, but you don't have to be that way, right?
Absolutely correct.
And they only feel better after the treatment, and only then they answer, Doctor, I didn't know this is how all the normal people feel.
Yes. They're so used to living with their symptoms.
Exactly.
This is about quality of life.
Yeah.
We address the quality of life. For instance, may I just close with this? If you're female, your estrogen and progesterone, most people don't know this, are controlled. It's a master hormone, are controlled by your thyroid, let alone all the other hormones. 60 other hormones. Actually, there's a couple of hundred hormones in your body. But so your estrogen and progesterone are controlled by your thyroid. Balance your thyroid and you get beautiful smoothing out of your
way of
monthly
saying
cycle.
Oh, the monthly cycle, yeah.
Yes.
Definitely. With the PCOS and irregular cycles and the stressful lifestyle, it is completely necessary. All right. Thank you so much, Dr. T. It was amazing talking to you. Although it's just basics, but this is all we need as of now. And hope we'll do this again, and hope you'll agree to do this again. And
Dr. Rash, I have so much more to share.
yes.
This is what I enjoy, and this is why I still am in practice.
All right. Thank you. Thank you so much.
Thank you, Dr. Rash. Thank you.